Good afternoon, everybody. Today is another day we are going to focus on another medical condition in our series of lectures. And today we are going to focus on fungal infection. We know very well that fungal infection is very common in the tropics because the tropics contains humidity, contains a lot of temperature, warming and a lot of oxygen. It's make them an environment for them to multiply and cause a disease. So generally, let us look at the general concept of fungal infection. So the fungal represent a diversity heterogeneous group of epicytes. And most of these organisms are like plants because they have something called hyphae. Hyphae is like branches. And again, these few of them of these fungal microorganisms cause disease. Others are very good in our setup, like fermentation and in breakdown of dead tissues, rotting tissues. All of these ones, they are very good for that one. So they are very good in another way or the other. So you know very well that fungal is affected by temperatures. In high temperatures around 27 degrees Celsius, it forms spores, and in low temperatures, it forms molds. So in a nature, fungal generally grow by splitting enzymes that digest tissues, but that are sometimes where they get their feet. And generally, the fungal are classified in two pieces. Those are in the vegetative stage, and those ones are in the reproductive stage. So in the vegetative stage, the cells are haploid and divide mitotically, and most fungals exist as moons in the hyphae. Hyphae are like branches. And the fungal are usually unicellular, yeast, most of them are unicellular, and sometimes fungals change morphologically and are found as dimorphic. They can change their way they look like. And you know very well that, for example, Candida is formed in the yeastic form at that 7 degrees Celsius. It's a yeast at 7 degrees Celsius, and the change into moles at 25 degrees Celsius. So in the reproductive phase, fungal may undergo either asexual or sexual reproductive. Asexual reproductive involves the generation of spores, and the sexual production requires a cellular structure that are used for taxonomic and differentiation. So the fungal are classified based on the characteristics of their sexual phase. For the kingdom of fungi, there are two phyla, that is zygomycota and the Dichomycota. The phylum Dichomycota is further divided into two subphyla. For example, is Ascomycotina and the Mycotina. Another group of the fungal for which a sexual phase has not been observed is termed as the Mycotina. So group representative genera is phylum Zygomycota, and that is Exoplas, Absidia, Muca, and the phylum Dichomycota is a subphylum like Ascomycotina, which comprises of Trichophyton and histoplasma. And the blastomyces. So in this class, this class of Ascomycosina, the most important there is the histoplasma. So the other one is phylum Mycotina. This contains Cryptococcus, which is very common, known for causing what we call fungal infections in central nervous system. So for class Mycotina, the common one is Candida, which causes vaginal candidiasis, oral candidiasis, esophageal candidiasis in etc. And the coccidiosis, which is a very common problem in chicken and also very common in people who are associated with keeping the birds. So let us see the distinctive properties of fungal. Mycotic infection are classified by the tissue, they are colonized. For example, there is superficial infections, and the superficial infections is limited to the skin and the hair. And then you have cutaneous infections, that is a little deeper, which involves the epidermis, hair, and the nails. Then we have subcutaneous infections that involves the dermis, subcutaneous tissues, and the muscles. So in addition, mycotic infections may be systemically and generally originating lungs and other organs, because the lungs is the most common where it is an airway which is open, and so many microorganisms can penetrate, especially if there is a problem in the senior or the physical defense mechanism of the body in terms of respiratory system as a challenge. Then we can have these opportunistic infections, especially in the lungs. The most common ones in the lungs is like the one we call histoplasma or aspergillus. In addition to what are cavitated because of tuberculosis, it can go there and then start growing. So this is the defense mechanism of the skin. You have to understand the dermis, the bellis, and the epidermis. All those ones, that is the area where it is affected. You can see the blood supply, you can see the hair, you can see the ductus of the green sweater glands, the hair, the skin, and the hair. It is very hard, so it is a physical barrier of our body, and it is always affected by a topical and fungal infections. So superficial infections is limited to the outer layer of the skin and the hair. For example, pityriasis pericosa affect the skin, Tinea nigra affect the skin, and the black and white piedra affect the hair, and Malanesia and expodia and piedra, because plum causes the hair infection. So you can see the hyper there, you can see the various type of infection in various places when they have been magnified. So you can see how these tissues are affected. You can see that you can see pityriasis pericosa magnified when it is on the skin. You can see Tinea nigra B. You can see when it is magnified, and you can see black piedra C when it is magnified, and you can see white piedra when it is all these ones are the skin diseases which are effect on our body and topically on our skin. So you can see a clinical presentation of pityriasis pericosa, those spots on our patient's abdomen, which is a very common problem, especially in Mombasa, Kenya. So you can see a laboratory test of yeast-like cells of exopedia or identity that causes Tinea nigra. When you scrub this one and put it in a chemical in a laboratory, this is what you are going to see. So this is how the skin scraping stain in periodic acid looks like for swing stain, typically yeast-like and hyperfragment of Malassezia papa, the theoretical agent of pityriasis pericosa. This is the microorganisms which cause these problems. Then you can see the clinical presentation of Tinea nigra. Note the black pigment in the center of the palm, which causes Tinea nigra. So, cutaneous involves deeper epidermis and keratinized in bonded areas. Keratin is a type of protein which does not get blood and does not get enough blood supply, which means they have tissues like the skin, the hair, and the leaves. So diseases are generally cosmetic and not like vitamin. So diseases of the skin are termed as tinea. Diseases of the hair and nails are termed as dermatophycoses. Trichophyton, Microsporum, Epidermophyton are examples of these diseases, which are diseases of the hair and the nail. So you have subcutaneous, which involves dermis, subcutaneous tissues and the muscles, and the fungal are generally implanted in skin. Fungal diseases are lesions. Lipocutaneous, the Cryptococcus, mycosis, and the mycotic mesenteria are examples of these subcutaneous types of diseases. So, like spirodraxis, pseudoparaskeria, and many others are examples in this class. So, let us look at systemic fungal infections. So, originate most commonly on the lungs, because we have seen that the respiratory system is an open system, so it can get so many things, it can go there. So there is phagocytosis by macrophages, so that That's not explained very well, but the macrophages will be able to work if the immune is strong and able to do things. So most primary infections are inappropriate and the progression may produce hormonal symptoms or ulcerative lesions. Post response produce a formation of fibrous tissues, granuloma, and calcified lesions. For example, in osteoplasmosis, you see something like what we call a cannonball appearance on an X-ray in somebody as a what? As as a histoplasmosis. So representative organisms are endemic and except for Cryptococcus, which is a yeast. So histoplasma, it may become endemic, most infections are asymptomatic, and histoplasma capitarum, and it's the common cause of histoplasma. And histoplasma is very common in post-TB patients and a cavity, and it's very common associated in bats. So we have brastomycosis, endemic and important retinal problem, and this is associated with people who do a lot of sea animals, brastomycosis and dermatitis condition. It's the microorganism. So you have mycosis, which is endemic in Central and Southern America, primarily in Brazil. We have paracopidiosis brasiliensis. We have epidermophyton. This is endemic in Southwest United States of America and the organism called Cutaneous immunities. Then we have Cryptococcus, which commonly cause meningitis, especially in patients with immunosuppressed children, elderly people, and also people who are on chronic diseases like diabetes, hypertension, and HIV/AIDS. So the microorganism which causes Cryptococcus respond to Cryptococcus families. So we have opportunistic infection. These organisms may generally have a role potential for very maintenance severe diseases within the body tissues. For example, a candidiasis, which can be a secondary infection in vaginal infections in patients with diabetes, hypertension, patients who are taking cancer, people are taking steroids, people with liver conditions, all these ones, and those children. Then aspergillosis also is a opportunistic infection, like mycosis is another one. And the most common causes is Candida albicans causes candidiasis, and also aspergillus causes aspergillosis, and rhizoplas causes mycosis. So let us look at the pathogenesis of fungal infection. So most of mycotic diseases often consequence of predisposing factors like age, either extremities of the age, very young, elderly, stress, or any other pathological conditions, for example, diabetes, hypertension, cancer, chemotherapy, and hypertension, steroids, autoimmune conditions, hypersensitivity, all those type of conditions which cause immune to be suppressed. Also, even malnutrition also can be associated with causing this kind of fungal infection. So, fungal infection purely much depends on the specific factor which causes this person of this problem. So, only the dermatophytes like Trichophyton, Microsporum, are what? And the most and the Candida are communicable from human to human, and being others are acquired from the environment, especially from the plants, soil, comets, or water, all these ones. So fungal generally causes one of the lead distinct tissue response. It causes chronic inflammation process resulting in scarring, activation of weak tissues, and also number 3, it causes granulomatous inflammation, leading to correction of modifying epithelial cells and lymphocytes. Then also it causes acute respiratory inflammation process, causing vascular congestion, exhibition of plasma, and accumulation of lymphocytes. So some of the tissues response may be linked with mycotoxins, which are the toxins produced by that fungal infections, which are a fungal metabolite that are toxic to the host. Some agents like RPS-like endotoxins or hemolysis or steroid-like toxins that affect the nervous system. So aspergillus produce a toxic called aflatoxins that have been strongly associated with liver cancer. So with liver cancer. So for example, in Thailand, where people generally consume about 25 times more aflatoxins in their diet, the incidence of cancer is about 18 folds greater. So there is a correlation between aflatoxins and the cancer and disease. So systemic mycosis are generally asymptomatic, but may have a generalized symptoms including low-grade fever, seeking fluids, light sweating, or loss of appetite. And so let us see the host defense. So host defense against the fungal includes non-specific and specific factors. For example, a non-specific defense includes the skin which contains the lipids, the fatty acids in a normal floras. And then we have the internal factors like mucous membrane, secreted cells, macrophages. All these ones are the factors which are non-specific, which are present in the body. Blood components, temperature, genetic, and hormonal factors. In other words, both physical and chemical factors and phagocytic defense play major role in prevention and control of mycotic and diseases. So, specifically, defense includes both moral and cell-mediated. The role of moral defense is somewhat controversial since certain antibodies are not protected. So it is not protected. So that means there is a area of standing to gas stand so that you can understand the moral defense mechanism in terms of funding. So it is possible that high titers of certain antibodies actually suppress the cell-mediated defense? Nevertheless, some antibodies may be protected. For example, antitoxins and opsocins can be protected. So generally, however, the cell-mediated defense are probably more important acquired systems is usually T cell mediated and not and those people with a compromised cell mediated defense type of what of the disease. So people with a cell compromised C cell defense mechanism and every disease is known. So let us look epidemiologically. As you come towards the end of this lecture. So the dermatophytes may be communicated from one person to the other through using the form, tiles, bendings, all of those. So these infections termed as tinea or affecting the skin, include ringworms, aggressive food, jockey eats, etc. Candida is a member of the normal flora of the vagina. And candidiasis is often associated with diabetes, steroid, hypertension, family planning pills, any condition which causes too immune can cause some vaginal candidiasis or even candidiasis of the mouth as esophageal, even gastric candida also can cause this one. So in some cases, mycosis is associated with the condition because in this more of associated with the soil and the animals. So for example, sporosphites is normally found in woody plants and Cryptococcus occurrences more often. Similarly, histoplasma is often found in old plants or but spirits and gives workers or persons who go to community dinner may acquire more often. So how do we diagnose this thing we call fungal infections? Clinically, the clinical examination, history taking, what you see on your patients plays a big role for you to make a diagnosis in terms of fungal infection. For the dermatophytes, appearance of the lesion is usually diagnostic. For systemic mycosis and epidemiology and entomology are usually clues. So a laboratory treatment of the skin scars with 10% potassium hydroxide can have our spores by scraping check that to confirm the disease. Most fungal can be grown as on some drawings are, but they are often very difficult to proceed. Some fungal show aerial fluorescence and a real resistant and normal ultraviolet light and the skin testing for unveiled hypersensitivity because it is very for the local purpose of diagnosis. So, how do we control this technology? The pure management and the control of fungal infection is purely sanitation. Control by sanitation means means is different, but the incidence of vulnerability can be reduced by being general hygiene. The key thing is general hygiene, personal hygiene, and public hygiene. The one is summarized by the word hard hygiene. Regular washing our hands is very key in preventing these diseases. So there is no vaccine currently available in terms of fungal infections, and chemotherapeutic drugs are there, but they are toxic. And sometimes we always like to use topical, then we take a systemic, because of these drugs are actually toxic in the liver. So it is very advisable to start with topical if the skin is the one is affected, then you go to. If you cannot be able to avoid the topical, then you can go to systemic because these drugs are toxic, especially to the liver. So topical powder are the creams often contain Trichophyton or other derivative like the micronazole, glutinazole, axtrond, and are used for superficial dermatophytes. So Cryptococcus may be treated using potassium iodide or amphotericin B. So systemic infections are generally treated by amphotericin B and FS, 5S, micronazole, and Cutaneous. And that one brings to our topic about fungal infections. You remember to wash your hands regularly, to ensure your immunity is okay, advise your efficient with that so that you can prevent fungal infection. Thank you very much for listening. Peace.